Hi everyone, this is the Cardiovascular Assessment, Chapter 19. Here are your learning outcomes. Don't know why that's on there. So your anatomy and physiology is something for you to review. You're not going to be tested on it, but you need to have an understanding of how it works so that you understand what causes some of the problems and abnormalities. So with the heart, you have the base, which is the top part, and you have the apex, which is the pointy part down there at the bottom. Apical impulse is the point of maximum impulse, or the apex. That's where we get an apical heart rate. The heart sits in the thoracic cavity between the lungs and above the diaphragm in the mediastinal space. So here are all of your parts of the heart, the different valves. Heart sounds, there is S1, S2, and those are going to be what you're going to be listening for, or your lub-dub. The S1 is when the mitral and tricuspid valve closes, and S2 is when the aortic and pulmonic valves close. So these are the two sounds that cause the lub and the dub, and that's all you're going to be listening for. You may hear an S3 or S4. We're not concerned with that in this class. Systole is the phase of ventricular contraction, and diastole is the phase of ventricular relaxation. Just some terminology that you should be familiar with. So pulmonary circulation includes your arteries, veins, the pulmonary capillaries. Pulmonary artery is the only artery to carry unoxygenated blood, and the pulmonary veins are the only ones that carry the oxygenated blood. So it is a systemic circulation that we're going to be looking at. We are going to be, you need to understand that the circulation is what provides the oxygenated blood to all the peripheral capillaries and returns deoxygenated blood to the pulmonary circuit, so it can pick up more oxygen and also get rid of the carbon dioxide. So your landmarks that are going to be important, the left mid-clavicular line, so halfway between the left clavicle, the sternum, which is very important, the xiphoid process, and we're going to talk about several of the intercostal spaces. So cardiac cycle is a contraction and relaxation of the chambers. That's considered one heartbeat. It is electrical and mechanical, the electrical causing the mechanical contraction and relaxation of the heart. So special considerations that we are going to be looking at are as listed here. Oops. So healthy people, health promotion considerations, we need to take into account for Healthy People 2020. One of the goals is reducing mortalities due to coronary heart disease and stroke, and making sure that we are using cardiovascular screenings to monitor somebody's blood pressure, monitor their cholesterol, listening to their carotid arteries to make sure that they aren't blocked. So lifespan considerations. Infants and children, obviously the fetus gets its oxygen from the mother. Changes occur in the cardiovascular system in the first few days of life. Infant's heart rate is initially fairly high compared to an adult. You'll get more of this when you have your maternal and child health section. The pregnant female, remember, because of the uterus pushing up on the diaphragm, the heart can be displaced up to the left and upward. We talked about the fact that there's going to be an increase in the circulating volume, cardiac output and stroke volume increase, resting pulse may increase, murmurs may be heard when somebody's pregnant, may disappear after pregnancy. With older adults, we have a loss of ventricular compliance and vascular rigidity. So compliance is the stiffness or the ease of the heart muscle to relax and fill with blood, and that really decreases as somebody gets older. The conduction system loses some of its automaticity, so sometimes we have our elderly with pacemakers because the electrical impulses aren't functioning properly or correctly. So psychosocial considerations are very important because stress can increase the workload of the heart. Race and ethnicity, family history. We want to know if they have a family history of coronary artery disease, hypertension, high cholesterol. When we're talking about race and ethnicity, there are some cultures that over-fat individuals are considered healthier. Also, selection and preparation of food, especially with red meats and saturated fats, come into play here. Also, with cultural, racial, and ethnicity, we have African Americans being at a higher risk for coronary artery disease and hypertension, and Caucasians are at a higher risk for high cholesterol. Native Americans are at a higher mortality rate from coronary artery disease also. So substance abuse, especially cocaine, alcohol, and tobacco, can have a huge impact on the effectiveness of the cardiovascular system. So your focused interview is going to address all factors, taking into account all of these variables. We want to ask our patient about their sense of well-being, their ability to perform their work, their ADLs, family history of coronary artery disease, hypertension. We need to look at their weight, their height, diet, exercise, and also we want to look at any infection that may affect the cardiovascular system. Things like rheumatoid fever, endocarditis, pericarditis. And it's also important to ask your patients, do they know what their blood pressure normally runs? Do they know their cholesterol levels? Because these are important things for them to understand and realize the risk factors. Oh, well, I think I just went over those pretty much. So we're going to be inspecting, so we're going to be looking at the anterior chest, and we're going to be auscultating. We're going to be also palpating. These are the sites. So the first site is going to be the right midclavicular line, or in this picture it says right sternal border, so close to the sternum, and the second intercostal space. Number 2 is going to be your left sternal border, second intercostal space. The third place is left sternal border, third intercostal space. And then number 4 is the fourth intercostal space. And then the fifth is going to be the midclavicular, left midclavicular, fifth intercostal space. And then number 6 here for palpation, that's going to be something that you don't have to do, but that's where you're going to be palpating lightly to see if you feel any bulging in that abdominal aorta. Okay, so you're going to be, this says using the diaphragm and the bell. You're going to be using the diaphragm of your your stethoscope. You're going to be putting it against the patient's skin. You're going to be listening to that first area, which is the aortic area. Okay, this is the picture I wanted. All right, so the first place is the aortic area. That's the place where those sounds for the aortic, the aorta is the loudest at that place, and that's the second intercostal space on the right side. The pulmonic area is going to be the second place you're going to assess, and that is going to be the left sternal border, the second intercostal space. Erb's point is the third intercostal space, and that is where you are going to count your apical heart rate. And the reason that you count it there as opposed to the fifth intercostal space, or the actual apex of the heart, is that it is louder at Erb's point. So that's where you can place your stethoscope, count for 30 seconds if it is regular. If it's irregular, you need to count for 1 minute. If it is very irregular, you may have to start over in your counting. The fourth intercostal space on the left side is going to be the tricuspid, and the mitral area is the fifth intercostal space, midclavicular line. Easy way to remember this is either ape to man or all pigs eat too much. So should be in that order: aortic, pulmonic, Erb's point, tricuspid, and mitral area. This is going to give you just a quick, okay. You can copy and paste these. Okay, normal heart step, normal versus abnormal heart sounds. Okay, so that's your lub dub. Abnormal, you've got some swishing going on there. And again, you do not need to be able to identify these. All you need to be able to identify, don't know why that comes up, is that it's abnormal. Okay, so this is your documentation, and you're going to, and I am going to be videotaping, hopefully tomorrow, the cardiovascular assessment, and that's about all I have for this.